So for my research question, I decided to focus on malnutrition, incidence of tuberculosis, and the maternal mortality ratio, particularly in Central America. I wanted to see whether or not there was a correlation between malnutrition and key health conditions, assess how different countries' health conditions changed over time with the implementation of MDGs, and offer how health policy in Central America should be changed in the future. So the region that I focused on is the Mexico-Central American region of developing economies as defined by the World Economic Situation and Prospects of 2012. So this is a line plot that represents the percentage of underweight children under age 5 by country of the 7 different countries: Costa Rica, El Salvador, Guatemala, Honduras, Mexico, Nicaragua, and Panama. Underweight and stunting are two indicators that the World Health Organization uses to assess malnutrition. So in this data visualization, we can see that Honduras, the purple line, has the highest drop in percentage. Costa Rica, the dark blue line, has the lowest percentages overall, and Guatemala, the green line, has the highest percentages overall. The black line, which represents the average percentages for the Latin America and Caribbean region, is only above the percentages for Costa Rica and closely follows the pink line that represents Panama. This means that most of the countries represented in this line plot have percentages of underweight children far worse than the average percentages of the Latin America and Caribbean region. The line plot presented on this slide represents the prevalence of stunting, height for age of children under age 5 for the same 7 countries. Looking at the whole graph, El Salvador has the highest drop in percentage. But if we look at the data starting from 1990, Honduras has the highest drop in percentage. Again, we see that Costa Rica has the lowest percentages overall, and Guatemala has the highest percentages overall. This time, Costa Rica is the only country that is below the line that represents the Latin American and Caribbean region. However, overall, all of the countries are on a decreasing trend. Mexico saw a fairly large increase beginning in 1990, when the other countries saw the beginning of a decreasing trend, and this may have been due to the Hurricane Diana that occurred in 1990 and the repercussions that the country faced. This line plot represents the incidence of tuberculosis per 100,000 people for the same countries. Again, we see that Honduras had the highest drop of incidence, reflecting its highest drops in percentage of stunting and underweight children. The timing of when the drops occur seems to be around the year 1995. Additionally, we see that Costa Rica has the lowest incidence of tuberculosis. In this graph, we can see that Mexico and Costa Rica have incidences of tuberculosis that are below the average incidence of tuberculosis for the Americas. As opposed to the line plots for stunting and underweight children where all the countries had decreasing trends, this line plot seems to have countries that have trends where the countries experience relapses and the incidences seem to get a little bit more worse over time. This next line plot portrays the maternal mortality ratio per 100,000 live births in the same countries. We see that Honduras has the steepest drop in maternal mortality ratio from 1990 to 2000. Interestingly, in Honduras, the drop in maternal mortality is before the drop in incidence of tuberculosis by approximately 10 years. Again, we see that Costa Rica has the lowest percentages. Both Mexico and Costa Rica are countries that have ratios that are below the average ratios for the Americas region. Overall, Nicaragua has the highest percentages, and Panama seems to experience nearly no change in their ratios from 1990 to 2015. So it seems that there is no direct correlation between malnutrition and key health conditions such as incidence of tuberculosis and maternal mortality ratio, and this may be because the DPs that developed did not factor into the potential effect of time lag between the potential cause and effect. However, I discovered interesting trends that were apparent and for the most part consistent in each of the data visualizations. First of all, Costa Rica consistently had the lowest percentages, incidences, and ratios of negative health conditions. All of the health indicators, except for percentage of underweight children, had a steady decreasing trend. This may be due to the fact that Costa Rica is largely regarded as having the most stable and most democratic government among the Central American countries. Such a government allows for the people's voices to be heard and for a universal healthcare system to be established and then reformed in the 1990s with a larger emphasis on expanding coverage. Additionally, Costa Rica has a policy that focuses on human development and therefore the health of its population. And this is all according to the World Health Organization and articles on NIH, the NIH website. Furthermore, Honduras experienced a reform in its health system beginning in 1990 as well, which may explain the steep drop that is shown in each data visualization. The reform aimed for a more progressive integration of the public insurance of the country and that the population has access to timely and quality health services. Looking at both Costa Rica and Honduras, it seems that healthcare systems that focus on spreading coverage and providing quality basic health services through public insurance seems to work and help improve the health of the population. Policymakers could research further into these two countries' health systems and see why the reforms worked and use them as examples for other developing nations. Countries like Guatemala, which consistently had the highest prevalence in regards to malnutrition and was still fairly high in incidences of tuberculosis and maternal mortality ratio, have health systems with high levels of private expenditure and unequal access to healthcare facilities. Nicaragua also has an issue with rural regions having less access to healthcare facilities, and thus the population in rural regions have worse health. Therefore, this is an indicator that unequal access to healthcare facilities need to be eliminated. When we look at the data visualizations as a whole, we notice that some countries are consistently in worse health conditions compared to other countries. And also typically when one health indicator is bad, the rest are bad as well. This is an implication that countries such as Nicaragua and Guatemala, the two countries that seem to be faring the worst out of this group of countries, need to be focused on to protect the health of the population. We recommend UN health organizations, medical NGOs, and developed countries in North America provide due attention and vital resources to help Nicaragua and Guatemala to improve their public health infrastructure. Communicable diseases like TB knows no borders.